When I'm golfing, it's just me and the ball. It keeps me focused and my mind off my moderate to severe atopic dermatitis, eczema. I used to hate going outside and having people look at my skin. Now I appreciate going outside so much more. I'm not worried about what's seen on the surface. There's a golf saying, play the course, not the opponent. I play the course to beat my opponent, eczema. I played sports pretty much every day after school. A lot of people broke bones. A lot of people had muscle injuries. Although it wasn't a sports injury, my injury was the eczema on my skin. We didn't know what it was at the time. We thought it was poison ivy. I had been scratching it frequently. It did bleed some. When I went to school, they wrapped it up and said, hey, you might want to have your mom take you to see your physician. When I went to the doctor and they checked me over and they made my mom aware that I had eczema, then they gave me prescription cream. They would get rid of the rash, but that was only temporary. Each doctor that I seen, they would try different ones to see which ones would work better. Once I passed high school, my eczema started to worsen. I would see it more frequent. It started spreading more and more, and it would cover pretty much about 70% of my body. I had a closet at my house that I stored lotions, creams, ointments, anything at the time that, depending on the severity of my eczema, it was a confidence thing. It was embarrassing. I was ashamed to expose areas of my body because it was the fear of what somebody would say. I was pressed to go see a dermatologist. He examined me from head to between my toes. My dermatologist diagnosed me with moderate to severe atopic dermatitis. It's a form of eczema. He said, hey, I think I got something in the works for you. He recommended. He recommended Adbry. My doctor explained to me that Adbry is a biologic injection approved by the FDA for adults with moderate to severe atopic dermatitis that is not well controlled with prescription topical therapies. I learned Adbry is a fully human antibody that works with my immune system to specifically target one of the proteins that contribute to skin inflammation, eczema. He also said Adbry is administered initially with a dose of 4 injections, then by 2 injections given every other week. We discussed the possible side effects and created treatment goals as well. I went home and I explained to my wife everything that happened at the dermatologist's office, and I read about Adbry. So that helped me make a decision. I have never been a king with needles, and I never would thought I would be giving myself my own injections. Healthcare professional showed me how to do the injections, and believe it or not, I'm able to do them myself, and now it's part of my every 2-week routine for my treatment. Since starting Adbry, I wasn't hurting anymore, and I wasn't itching anymore. My skin still had flaky patches on my skin, but after continued usage of the treatment, that went away. I went to see my dermatologist for a follow-up report. And I went in there and he looked at my skin and he said, "You look gorgeous." And I looked at my skin and it was nice and smooth. And I was rubbing my arms up and down, and I said, you know what? I really do feel gorgeous. This is my experience. Everyone else's experience may be different. My confidence level has changed a lot. I feel more confident that I don't have to go places and be ashamed of how my skin look. I don't have to cover up spots on my skin anymore. I'm not ashamed of my body like I used to be. Eczema was a way of life for me, and I had to look deep inside of myself and understand that what was inside was better than what was seen on the surface of my body. I would say Adbry is a hole-in-one for me.
Important safety information and indication. Do not use Adbry if you are allergic to tralokinumab or to any of its ingredients. What should I discuss with my healthcare provider before starting Adbry? Tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic helminth infection, are scheduled to receive any vaccinations. You should not receive a live vaccine if you are treated with Adbry. Are pregnant or plan to become pregnant. It is not known whether Adbry will harm your unborn baby. There is a pregnancy exposure registry for women who use Adbry during pregnancy. The purpose of this registry is to collect information about the health of you and your baby. If you are pregnant or become pregnant while taking Adbry, you are encouraged to enroll in the registry. You or your healthcare provider can get information and enroll you in this registry by calling 1-877-311-8972 or visiting https://mother-to-baby.org/ongoing-study/Adbry-tralokinumab. Are breastfeeding or plan to breastfeed. It is not known whether Adbry passes into your breast milk and if it can harm your baby. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. How should I use Adbry? See the detailed instructions for use that comes with Adbry for information on how to prepare and inject Adbry and how to properly store and throw away, dispose of, used Adbry pre-filled syringes. Use Adbry exactly as prescribed by your healthcare provider. Your healthcare provider will tell you how much Adbry to inject and when to inject it. Adbry comes as a single dose, 150 milligram, pre-filled syringe with needle guard. Adbry is given as an injection under the skin, subcutaneous injection. If your healthcare provider decides that you or a caregiver can give the injection of Adbry, you or your caregiver should receive training on the right way to prepare and inject Adbry. Do not try to inject Adbry until you have been shown the right way by your healthcare provider. If you miss a dose, inject the missed dose as soon as possible, then continue with your next dose at your regular scheduled time. If you inject more Adbry than prescribed, call Poison Control at 1-800-222-1222. Your healthcare provider may prescribe other medicines to use with Adbry. Use the other prescribed medicines exactly as your healthcare provider tells you to. What are the possible side effects of Adbry? Adbry can cause serious side effects, including allergic reactions, hypersensitivity, including a severe reaction known as anaphylaxis. Stop using Adbry and tell your healthcare provider or get emergency help right away if you get any of the following symptoms: breathing problems, itching, skin rash, swelling of the face, mouth, and tongue, fainting, dizziness, feeling lightheaded, low blood pressure, hives, eye problems. Tell your healthcare provider if you have any worsening eye problems, including eye pain or changes in vision. The most common side effects of Adbry include eye and eyelid inflammation, including redness, swelling, and itching, injection site reactions, high count of a certain white blood cell, eosinophilia. These are not all of the possible side effects of Adbry. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. What is Adbry? Adbry, tralokinumab-ldrm injection, is a prescription medicine used to treat adults with moderate to severe atopic dermatitis, eczema, that is not well controlled with prescription therapies used on the skin, topical, or who cannot use topical therapies. Adbry can be used with or without topical corticosteroids. It is not known if Adbry is safe and effective in children.